Hello, everyone, and welcome. And thank you for tuning in to Health Leaders, the place for peer-sourced and solution-focused insights for healthcare executives. My name is G. Hatfield, and I'm the nursing editor for Health Leaders. Today, we are speaking with Amanda Shrout, who is the Chief Nursing Officer at LifeBridge Health, about her career and her thoughts about trends in the nursing industry. So, hi, Amanda, how are you?
Good. Thanks for having me today, G. I really appreciate it.
Of course, and thank you so much for being here. Congratulations on your new role. I hope
Yeah.
you're liking it so far.
I am. I absolutely love it. I'm the Chief Nursing Officer at Sinai Hospital and Grace Medical Center, which is two hospitals within the LifeBridge Health system. So super grateful to be in this role and excited to talk with you today about it.
Awesome. So let's jump right in. How did you begin your journey into nursing?
Yeah, great question. So my mom was like, I think you should be a nurse. And so
Hmm.
I think a lot of us have that example of like someone thinking like, oh, you'd be really good at this. But I dove in and got my undergraduate degree at York College in Pennsylvania. And I was really shaped by the professionalism of nursing as it was really taught in my bachelor's program. And I think that's something that has shaped my journey to be a nurse leader. But I've always loved working with people and with patients, and also just very focused on improving healthcare and seeing how we can make positive change in our communities. And I think one of the best things about serving here has been our commitment to our community and the communities that we serve.
Absolutely. And you mentioned your mom. So who have been some of your biggest influences?
Yeah, great question. I think one of the things that I've been really blessed with in my career is great leaders, and not necessarily in my direct, supervisor position, but
Hmm.
within just the organizations I've been in, and also some other opportunities. So one of my mentors is Lynn Gallagher Ford. She recently retired from the Ohio State University Fold Evidence-Based Practice, very long name.
Hmm.
But she recently retired from there, and I met her through doing some work with Ohio State and the Fold on implementation of evidence-based practice. We met back in 2014, I think, and she became a key mentor after that, and really was one of the first people who said to me, you can do more. What else do you want to do? And what does it look like if you dream within nursing? And that
Hmm.
dream really landed me here in this seat. The opportunity to serve at this level and be able to guide the strategic vision of nursing, to elevate nurses, and the work that we do. And I think she's been a really key mentor. I think there are lots of women here at Sinai and LifeBridge who are strong leaders and have reached out over the last 5 to 7 years and said, I'm here for you. What can I do? How can I support you? And I think every time one of them has answered my call of, I need help, or help me walk through this, or what would you do in this situation? I those experiences have added up for me and really gotten me to a place where I feel incredibly supported. And I think that's super important as we talk about who inspires us and who mentors us. It's feeling like you have that safety net or that cushion to fall back on.
Hmm. Absolutely. And it's always great when somebody sees your potential and really can nurture that. And I love that concept of dreaming within nursing. I think that's a really cool way to look at it.
Yeah, I think we think about, what do nurses do, and how do we do that? And I don't think that you become a nurse to decide like I want to be a chief nurse. Like that wasn't
Hmm.
the initial dream that I had. I actually thought maybe I was going to be a nurse anesthetist or a nurse
Hmm.
practitioner, and my journey was super different. I wanted to be a clinical nurse specialist after practicing as a frontline professional nurse for a few years, and that role is unique in that it is a little bit clinical and a little bit administrative, and I think that set me up for being able to do this really well. I still have a deep connection to the bedside and how the practice is happening, but I also have a seat at the table when we talk about strategic vision and how we move forward and how we elevate nursing to meet the challenges of healthcare. And I think it's a great mix of all of the things.
Absolutely. So, what was your best mistake and what did you learn from it?
Yeah, I think I love that you asked the best mistake. I'm gonna go with the most memorable.
Uh-huh.
I was running charge in an emergency department, and we had many ambulances lined up to get in the door and not enough spaces to put them. And I needed a patient in, I think, room 3 or 4 to be discharged. And they were supposed to go home like an hour before that. And I was expecting the room to be clean and ready for this next patient. And that was not how this was going. And so in the middle of the emergency department, I yelled something like, "Why is that patient still in this room?" And it
Mm-hmm.
was an epic failure. Like, first of all, there's no yelling in nursing. We're not doing that. And I remember it happening and then me being like, why did I just do that? What is going on? Like, this is not okay. And so
Mm-hmm.
I immediately went and told on myself, because that's what I do when I make these mistakes or these situations happen. But I think about that a lot when I think about making rash decisions and trying to figure out what we're going to do next. And so I've taken that best mistake with me through the last, I would say, 12 years of my career, and
Mm-hmm.
remember what it's like to be in that moment where I felt like, oh my gosh, I'm so embarrassed about this, but also what can I learn from this and how can I do it differently? And so I use that story when I talk to new nurses about how we
Mm-hmm.
lead, and how we lead with kindness and empathy, and how we have crucial conversations about, why isn't the patient discharged, and not raising our voice and doing anything crazy. So I think that's my most memorable moment of like, oh my gosh, how did I do that? I was in this leadership role and I did something that I should have never done. But I also think about it as like a very big learning experience, and knowing how I don't want to show up on a regular basis. And so it has grounded me in knowing how I do want to show up as a leader.
Absolutely, yeah, and I'm sure it happens. Nursing is really high stress, and
Yeah.
yeah, and I think we learn through failure. So
Yes,
yeah, it's a
exactly.
good mistake to make.
Yeah.
Yeah. So what do you think are some of the biggest challenges currently facing CNOs?
Yeah. I think one of our biggest challenges is workforce stabilization. I
Hmm.
think we talk about the nursing shortage. We know how many nurses are retiring in the next 10 years. We know how many retired during COVID. So definitely that workforce stabilization is huge. I think access to care is really important.
Hmm.
We're in a global budget model in Maryland where we have, a certain amount of dollars to be able to provide care. And so doing that well, and implementing, technology that's going to improve healthcare but not break our budgets is huge. I think there's a lot of pieces to what is challenging for CNOs. I think we each have kind of our own number one priority, but I would say for me, it definitely is that workforce stabilization. We want to see our nurses come, we want to see our nurses stay with us and grow with us. So maybe not in the same exact position that they were when they arrived, but be able to work within, our organization and grow with us. I think that's our biggest opportunity.
Absolutely. And on the same train as workforce stabilization, what are your thoughts on recruitment and retention, especially with, new generations coming up with new expectations and tenure nurses kind of, trying to keep them engaged in the workforce?
Yeah, I think it's trying to understand what each individual wants. So when we talk about patient care, we frequently talk about meeting our patients' individualized goals and expectations. And I think the same about our team members. So
Hmm.
one of our focuses is, how do we bring our nurse residents, our new nurses in the door? How do we get them engaged early? How do we get them engaged and keep them engaged through that like year 2, year 3, year 4 mark?
Hmm.
That's our biggest challenge. We see our biggest losses in those areas, and not because nurses don't like it here, but because they want to know what else is out there. And so I
Hmm.
think some of the ways that we do that, offering flexible schedules, offering alternative ways for them to work, meaning, maybe they're interested in learning something different and they want a role within IT, and how does their nursing background, you know come into play with that, and how can we leverage their strengths? I think there's lots of ways that we engage nurses and keep them here. For our more senior nurses, I think, we just want to keep them forever because the experience that they bring is invaluable. A couple of ways that we have done that that I think is innovative and really great is a nurse may retire with us, and then we welcome them to come back as a retired nurse, and they may work 3 to 4 hours a day doing different tasks. Some of that is discharge education, some of it is patient rounding, some of it is mentoring our staff and helping them learn different pieces. So I think there's lots of ways to keep staff members engaged, but I think it's important for CNOs to meet the staff where they are, not set expectations based on generational differences, but really understand what are the individual growth pathways for every nurse and how can we get them there.
Absolutely. So what are your, what are some tips for communicating and really staying in touch with your workforce? Because obviously I know a lot of CNOs have quite large workforces and it can be hard to keep up with everybody. So what are your thoughts on that?
Yeah, one of the best pieces of advice I got before I even took this role was from a previous chief nurse. And she said, the best part of my month was the 4 hours that I spent at the hip with one of my nurses. And she said I would go to a different unit every month and I would spend 4 hours next to the nurse. And so I thought about that, and I thought about, like, what does that mean for me? And so one of the things that I've implemented in this role is a rounding schedule. And so we round on patients regularly, but I also round on my units regularly. And so once a day, generally around 9 a.m. to 10 a.m., I am headed out of my office into a nursing unit. And I either do patient rounds on that nursing unit with the primary nurse. So I invite them to the bedside. We talk about what's going on with the patient and do a clinical focused round or a quality focused round, or I spend it rounding with a team in an area like peri-op, where I learn more about the functions of their charge nurse or how an ortho OR runs differently than a general OR. And so I think that the connection happens in the conversations that happen. Those conversations don't happen when you're in your office. I mean, certainly we are on meetings all day long and there's lots of decisions to be made, but I think the true work happens at the bedside, and I've appreciated those connections. And honestly, I look forward to that hour every day where I get out and I'm able to connect with the nurses. And I think my team has gotten very used to seeing me. So I was rounding today, and one of the nurses on rehab where I was, she said, "Oh, you're up here today. Good to see you." And so I think they're a little bit used to it at this point, and, welcome when I come by and engage with them.
That's awesome. Yeah, it's great when people can recognize you and say, like, "Oh yeah, I'm so glad you're back."
Yeah, they're
That's
just like, "Oh, you're
fantastic.
here?"
Yeah.
Like, that's fine. Like, they think nothing of it now. In the beginning, they were like, "What's going on? Why is the chief nurse here?" And I'm like, "No,
Yeah.
no, I'm hanging
Nobody's
out
in
with you. I
trouble.
want to, yeah, I want to know what's going on. What can I do to support you?" So I think, that's been the most meaningful, and making it a routine has been really great, because honestly, it is something that I just look forward to and I appreciate about my day. I'm always happy to not have another meeting. So
For sure, yeah. So speaking of connections, several CNOs that I speak to talk about how important it is for patients to have a nursing staff that reflects their community and looks like them. So how can CNOs incorporate diversity, equity, and inclusion into their recruiting strategies and into patient care?
yeah, I love the piece about really making sure that nurses look like their patients. So we serve an amazing patient population in Baltimore. And I think, we're really grateful for our connection with our community. We have a ton of community focused programs, and we really, hear from our community within our patient rounds. And also we have a patient family advisory council that provides us feedback. And I think the important thing about including DEI in our recruitment tactics are that we're out there looking for not just the same nurse. every single time. And so we have a very diversified strategy in that we actually have a strong international nurse recruitment program at Sinai and Grace. We've onboarded over 200 international nurses, many of them from the Philippines, but also this week I met a nurse. Oh my gosh, I'm going to forget. She came directly from India. We had another nurse come from Jamaica and the Middle East. And I think, we are grateful that nurses are coming here to help us serve our community. And with them, they bring their families and their culture and share with us. And one of the things I connected with the most at LifeBridge is that we celebrate our differences. So, we are not looking for 10 Amandas. We're looking for one Amanda and 9 other nurses who have different strengths. And I think that's something that we recruit for. We look for nurses with different backgrounds, different upbringings, but also just different educational preparation. We have a lot of nurses who have come to us from their second career. And I find that, what they're bringing to the table is just amazing in backgrounds with like education degrees or business degrees or microbiology. What they're bringing to the nursing profession is so rich that, you don't get that when you're looking for the same nurse every single time. So I think there's lots of ways that CNOs can do it. I think we all kind of come up with our own strategy around how do we serve our communities. But I definitely think one of our strengths is our international nurse recruitment that we've done.
Absolutely. Yeah. And it's all about getting that diversity of thought too, as well,
Yes.
because you never know when the next good idea is or where it's going to come from, kind of thing. So,
Absolutely. And I think that's huge. We recently launched our nursing professional governance councils, and we invite all of our nurses from each unit to participate in those councils. The meetings happen about every month, every 4 to 6 weeks. And what we promote in there is everybody has a seat at the table. So many ways that, nursing has looked at professional governance or leading through professional governance is by inviting specific council members to participate, and you get reps from each area. One of the ways that we are trying to do that a little bit differently and make sure that our new grads, as well as our experienced nurses, as well as our techs and our support staff have a voice is by bringing everybody to the table. We want to hear their ideas and really promote what they need to make this successful.
absolutely. Yeah. And speaking of governance, obviously, we just came out of an election season. There's lots of new things happening in healthcare right now. So how do you think CNOs can get involved in the legislative process and
Yeah.
advocate for nursing?
Yeah, I think there's a couple different ways. So I am very close to our government affairs team. So we have an amazing government affairs leader, and she's helped provide examples where we can go and testify in front of our state legislature. One of the experiences that I had last year was to go and talk to them about workplace violence and the toll that workplace violence takes on our employees and also the safety of our units when it's happening. And so I definitely think that strategic partnership within our health systems is really important. And it's important that we have our advocates. And the other way last year also went to the American Organization of Nursing Leaders Advocacy Day in Washington, D.C. And we were set up to meet with congressional teams across both the House and the Senate and talk to them about some larger bills and moving pieces forward. And so I think professional organizations are a really important way that CNOs and CNEs can get involved and really make sure that our voice is heard and that nursing is represented across the board.
Absolutely. And you mentioned it with workplace violence. Talk to me a little bit about that. How can CNOs help prevent workplace violence? Because obviously it's a very pervasive issue. The numbers are pretty staggering for nurses. So
It
what are your
is.
tips there?
Yeah, I think, one of the biggest ways is that we can speak out against it and really set precedences in our organization that violence of any form, whether it's harassment or physical violence or intimidation, is not permitted. And I think holding that line is really important. That's something that I've seen change over my career. I think when I first became an emergency nurse, there were just pieces where like patients were allowed to yell or be upset, and that has really changed. So I think first and foremost, as nurse leaders, we have to hold the line on that. We have to make sure that it's not tolerated, that we have signage throughout our organizations that shares the expectation with our patients. And then, if and when it does happen, we have to support our team members. So I think that's supporting prosecution. So one of the ways that we do that is making sure that our teams have a ride to court if there is a hearing. We pay them to go. We make sure that they have the right legal support and, support from our security teams. I think it's that partnership, making sure that our employees feel really supported. And then really, I think one of the important pieces is training and de-escalation. So we look at advanced training for our areas where that violence is happening more often in behavioral health and emergency departments, but also baseline training against, in all of our areas so that they can recognize escalation and also know how to de-escalate it appropriately and when to call for help. So when am I not going to do this by myself anymore? When am I going to set boundaries and walk away? I think all of those pieces are really important. Workplace violence is a huge opportunity for all of us. And I think we really have to set precedences in our communities that it's not going to be tolerated. In, the same way you don't want to go to the grocery store and see that happening. We shouldn't be seeing it in our emergency departments and our ICUs and anywhere else.
Absolutely. And I like that you touched on the piece about knowing when you're not going to be able to do it by yourself, because I feel like nurses, take on a lot by themselves and don't necessarily know when to ask for that help. So I think that's a really key piece of it for sure.
Yeah, we recently implemented some training. It's called Masada, but it's essentially an evidence-based like de-escalation training. And what we really look at is those pieces. So de-escalation, but also understanding like, when am I going to run away? Like, when am I not going to do this anymore and take myself out of the situation? Or when do I need to defend myself so that I'm not going to get hurt? And I think all of those pieces are really important. We've also equipped staff members with panic buttons and other pieces that just allow for an increased response of our security teams or other team members to that area. I think we have to come at workplace violence from like a multifaceted approach and be ready to just implement things that make sense so that our team members stay safe.
Mm-hmm. Absolutely. Yeah. So you mentioned panic buttons. I want to pivot a little bit to technology. It's a little bit more of an exciting topic. So what are your thoughts on new technologies like AI or virtual nursing, and how do you think they'll continue to impact the nursing industry?
Yeah, I think there's so many exciting things on the horizon. And I think that's one of the things that I love about nursing over, the last 15 years of my career. I've seen it change exponentially. And I think we're going to continue to see that. And I think chief nurses need to be able to pivot and know when to say yes to opportunities like predictive analytics or virtual nursing. Clinical decision tools are out there. I think there's lots of ways that we can incorporate it. I think one of the key focuses has to be, what do our frontline professional nurses need and how do we implement it with their guidance? There's lots of technology companies reaching out saying, hey, I can do this for you. And the answer is like, you could, but is it going to be meaningful? And what does it do for my staff? And so I think there is a lot of, I think there's a lot of opportunity. I think there's also evaluation of what is the most important and how do we strategically align with the vision. And so we've implemented a virtual nurse on one of our units, and we're really working through what does that look like and how do we do that really well. And, we have not jumped to expansion yet because we don't strategically feel like we are completely there, but we are on a very good path to get there. And I think, it's aligning with what do our nurses who are at the bedside caring for our patients need, and how can we alleviate some of that administrative burden through some of these other pieces, like our virtual nurse program or, other other opportunities. I've heard a lot about, speak to document and how we can do like that ambient listening documentation. And so I think there's lots of ways that the technology can be incorporated to improve patient care. And we just have to see how it's going to work out and see what works in our budgets and also what works for our teams.
Absolutely. Yeah. There's a CNA down at Houston Methodist who always says technology is best when it happens with nurses and not to nurses.
Exactly,
And I love that
100%.
quote.
Yeah, I love that. I think it is 1000% exactly what we need. There's so many, you know, companies who reach out and they're like, I could do this thing. And I'm like, great. But I don't know if my
You're like, I don't know
team
if we
was,
need it.
yeah, like, I don't know if my team is choosing that. I think, and I think it's best when it comes from a place of, we can alleviate this thing that is not value add in nursing. And, so much of the value add in nursing is the relationship we make with our patients and how we're able to move them to safe discharge or move them to out of the hospital care. And I think the technology we need is what's going to get us there faster and what's going to get us there with less administrative burden and more time at the bedside, making those connections.
Absolutely. And then to pivot to you personally,
Yeah.
what are you most proud of?
Oh, yeah. I think I got these questions a couple of days ago. I'm sure most CNOs do. And I was thinking about this. And one of the things that came to mind is on Wednesday, we do something called Frontline Quality Pulse Check. And it's where our frontline nurses are actually presenting to nurse leaders and some of their peers about the work that they're doing. And I think, I was listening to a nurse in our ICU talk about how they've increased their mobility score for their patients I think she was at they've increased it by 40% over the last 3 months. And hearing her talk about how they remove their own barriers. So how they designed a schedule where the night shift is going to evaluate whether the patient can get out of bed. And then the day shift is going to work together with their physical therapy team, their critical care techs, and actually get the patients out of bed around, between 10 a.m. and 1 p.m. And one of the things I'm most proud of is the ownership that our frontline professional nurses take in their patient outcomes. It doesn't happen by accident. It happens with empowerment, with providing them the tools and resources and the time to do that work and the time to come together and align on what the goal is and then work to get there. And so I think in life, I'm most proud to be a nurse and most proud to lead here at Sinai and Grace. And I love this. I truly love it here. And I think it's where I've grown up as a nurse, and I had my son here. And so the team very much knows him and treats us like family all the time. But I think professionally, I'm most proud of the empowerment of our frontline nurses and the investment in our patient outcomes and caring for our communities.
Absolutely. And then my last question for
Yeah.
you is, do you have any advice for CNOs or CNEs?
Oh my gosh. Well, I just became one. So
Mm-hmm.
I think I think my biggest advice is to just keep looking around, keep spending time at the bedside, keep understanding what's happening at the point of care. I think, we've all worked with leaders over time who have become disconnected or who don't necessarily understand or, who sit in a meeting and say, well, 10 years ago we did this, and so we're going to do that. And I think, one of our biggest opportunities is to follow the evidence always. We should be making evidence and data-driven decisions, but we should be spending time where the work is happening and really learning from our frontline nurses about what we can do and how we can support them. I'm frequently found on my unit saying, my job is to provide you the tools and resources to do this really well. And, I think that's our biggest opportunity is to align in the ownership of our accountabilities. So as a chief nurse, let's focus on how to get the resources to the people that need them the most and how to advocate and really empower our teams to work at the top of license and continue to care for our communities.
Absolutely. Well, that is a beautiful note to end on.
Thank you.
So thank you so much, Amanda, for your time. I'm really grateful to have had this opportunity to get to know you and hear your insights. And thank you so much to our audience for listening. Thank you.
Thank you.